Hospital officials at National Jewish say a third test on Andrew Speaker has turned up negative for the presence of the tuberculosis bacteria. According to doctors, that means the chances of others catching TB while on his flights are now probably very slim. Doctors are still awaiting culture results, though. With this recent TB scare, many travelers are concerned about TB and the risks associated with infected travelers. Michelle Reisman, a registered nurse and the executive director of Passport Health Colorado, joins us live in studio this morning with more on what you need to know before you travel. Good morning.
Good morning.
Tell us what you do in your office. Many people might not even know that this office exists.
Right. Yeah, it's very a new field, and travel medicine is a very new field. And what we do is we meet with the travelers who are traveling internationally, especially to lesser developed country. And that could be a business traveler, a recreational traveler, also people that are going on church-based mission trips too. And we meet with them, we decide with that traveler what immunizations are recommended for that area. Also, if they needed to be covered for medication-wise, for malaria. Also, any other concerns that they might have, such as tuberculosis. What is their risk for that area that they're traveling to or on the airplane?
And obviously you deal with more international travel, but I think many of us, when we travel just domestically, we think, what if this person next to me, they're coughing and they're sneezing, that air in that plane seems to be recirculated. Do we need to worry about that every time we travel?
You know, it is a concern, and I know a lot of people do get sick when they travel, you know, even domestically.
Even just colds and the flu.
Sure, absolutely. And you should get your flu shot every year, but of course I'm a nurse and I'm going to say that. But the air exchange on the airplane is more frequent than even in a home or office. So they really do and try and get fresh air coming, recirculating through the cabin.
Should we, I know some people even think, and I was surprised when I was in Boston this last weekend and at the airport, they had masks there for people who wanted to wear them. Is that all a part of now the culture that we live in and the scare like this one of tuberculosis?
Sure. And even with the SARS outbreak a couple years ago, people on the airplane were infected with SARS because of the long flights.
Does that make a difference?
It can, and it's really the person who is infected should wear the mask to keep the germs to themselves, but you can, and if it makes you feel better, you can wear a mask on the plane, but it's really the person who's infected that should wear the mask. You could always hand it to the person that's coughing next to you.
Are there some tests, summer travel upon us, those who might be traveling domestically or internationally, that we should be getting to be sure that we don't have some of these types of diseases? I mean, Andrew Speaker didn't know that he had tuberculosis until he had an x-ray for an injured rib.
Sure. You know, when people come into our office, into Passport Health, and meet with our travel nurse specialist, we will screen them to see if we need to do maybe a test before they go, and it's just a little skin test for tuberculosis. And if they are going to high-risk area, going for a prolonged period of time, I mean, if you're going on safari in South Africa, as opposed to taking care of patients in a hospital in Africa.
You're going to have some immunizations before you go anyway.
Absolutely. Either one, you're going to have some immunizations.
All right,
so.
Michelle Reisman, thank you for coming in this morning.
Thank you.
We appreciate it. Tom?